The books that I'd read had been really negative. And I wasn't interested in learning to live with the illness. So anything that talked about living with ME was not of interest. I didn't want to live with it. I wanted to recover from it. And we're talking kind of in the kind of mid to late 90s here. There was much less information than there is now. So I started to study people that had other illnesses, things like cancer and AIDS and diabetes and those kind of things, that had recovered and overcome these things, and started to look at what were the things that they were doing which was different. So this started a kind of a further 5-year journey of basically my entire life being about understanding the illness and what I could do about it, because, and it's quite an extreme view and not something that I would promote, but the perspective was I had no life till I recovered, as far as I was concerned. So my life was recovering. And as we'll talk about a little bit later, that's not necessarily a healthy approach to recovery, but nonetheless it's what I felt I had to do. And, you know, I had all kinds of beliefs like, who am I at 18, 19, 20 to think that I'm going to find an answer or answers to an illness that the world's leading experts say is not treatable. But one of the things that I did notice that I was doing which was really different, and this also came in, I ended up doing a degree in psychology and a lot of training in other areas of various forms of psychology, was that a lot of what medicine does, or traditional medicine does, is it basically studies the problem. So it takes all the people that are ill and it studies what's wrong with them, which is very different to looking at people which have been ill and recovered and find out what they've done, which has helped them to do that. So already I had a very different focus of how I was looking at things. I was looking at people that had been in situations like what I was in and looking at how they'd found a way to recover. So, again, cutting a very long story short, I did a huge number of different things. I saw over 35 different practitioners. At one point I was taking 70 supplements a day. I had the most expensive poo you've ever come across, excuse my language. And I'm glad that got a laugh, because sometimes I get really rude stares from people when I say that. So, you guys, so the nicer audiences up north from what I can see. So I just tried, I was literally trying everything, and, you know, so various things worked, and part of what we'll talk about, I used to do talks in the evening, I keep saying, I want to say tonight, but this morning, will be some of the things that worked for me, but obviously as the clinic then developed, we got a huge amount more experience. But to finish off the story, basically once I recovered, I wrote a book about my recovery story and about my experience of, it wasn't written as a kind of how to recover from ME, it was basically just my personal story. And that was eventually published. And in the final few years I'd been ill, as I'd got more energy, I'd done a lot of training in various forms of things on the psychology side. And so I started working as a practitioner, and for the first year that I was in practice, I had no desire whatsoever, quite honestly, to treat ME, because I just spent 7 years dealing with it. But over time what happened was, obviously, I realised that was the thing that I was most drawn to doing. And what I really wanted to do was set up the organisation, the kind of organisation that I would have wanted to exist when I was ill. And several things about that were really important. One of which was the absolute focus on researching and testing different ways of working. And obviously when you're doing that on your own, as one person, you don't get so much information, but as an organisation now having treated, I don't know the latest stats, but I say 3,000 or 4,000 people with ME and chronic fatigue in over 30 countries, you learn a hell of a lot from doing that. So one of the things was to not attach to any one answer as being the answer. Because one of the things that gets me quite frustrated in life is when people attach to one treatment or one way of working and they think that's going to be the same way for everyone. Because ME, chronic fatigue, is basically a blanket term for a whole bunch of sub-conditions. And so when you try and apply one process or one treatment to everyone, that it completely ignores the complexity of the illness. The other thing that that was also really important to me was I wanted an organisation to exist that wasn't just providing treatments, but was also providing the support beyond that. And we're very grateful these days for the development of things like the internet, because it makes it so much easier to do that. So, for example, we have a social networking website as part of the clinic, where patients can meet other patients that are on a recovery path and discuss their experiences. And because I found the isolation so difficult, or I would meet people with ME, but they weren't on the recovery path, and so I missed having that kind of contact. Which is why groups like this are great, because you have that sense of community with it. We've done a huge amount of audio and video, because for a lot of people, affording treatment is not always easy. So we wanted to find ways to accelerate the process and provide information in cost-efficient ways. So I think at this point we've got over 60 hours of audio download and over 7 or 8 hours of video download, which is available and a lot of it's completely free. So there's a lot of stuff that's out there anyway, and we'll reference that later. But just a final thing before I let Sanna say something, carried away, is that so we're certainly not here to present the definitive answer of ME chronic fatigue. What we're basically here to talk about is some general overviews of how to look at it. And we've been very fortunate over the years with the organisation that we get now over 200 inquiries a month through word of mouth alone, which means we have, say, this huge, for want of a better term, laboratory. It doesn't make people guinea pigs, but laboratory in terms of research and testing what we're doing. So a lot of what we're talking about this morning is based on our clinical experience. And there's a huge need for more research to be done in this area. And a lot of stuff we're talking about is clinical research, observation-based, rather than double-blind study-based. Having said that, we have a clinical trial which is currently in process, and we also, about 18 months ago, set up a charity to raise money for research to try and move the research side forward. Because quite honestly, talking to people of the traditional medical system that come from the standard research point of view, without research makes it very difficult to get things accepted. And we're definitively not here in any way doctor bashing. Sanna's married to a doctor, so and also because we're absolutely into integration. There's a lot of stuff on the traditional medical side that very nicely integrates a lot of stuff that we're doing as well. But anyway, I've just ranted for 20 minutes on it. As Sanna said something, and also, I think a lot of that I've already basically said, but basically what we're saying is ME is a complex illness with a lot of things that are going on.
Yeah, I mean, I think what you'll find today as well, as Alex said, I mean, it's quite difficult to try to condense everything into less than an hour and try to. But I think what we want to do is try to give you a flavour of how we work, look at some of the issues that tend to be common denominators in people that we see coming through our clinic, but at the same time to really give you the idea that, as it says here, it's a complex illness. It's interwoven sort of interaction of mind and the body, and how it plays out from one person to another is often quite a different thing. So ME is just a blanket term for a set of symptoms, and also I think the one difficulty with it always is that diagnosis is often through process of elimination rather than any specific. You can test, I don't know, just trying to think, if you've got a sort of norovirus or something, lovely tummy bugs that have been going around this winter. Well, you can prove you've got it, and then so therefore the symptoms that you've got with runny stomach and all that kind of stuff, you can, X equals Y, and there's a very clear relationship, and so therefore you can treat it in a very focused way. Whereas with this, it's a bit more like one of these other really helpful blanket diagnoses like IBS, which is just something like, well, your digestion's not quite playing ball, and for one person it's something, and for other person it's something else, how it actually plays out.
But I had IBS actually prior to getting ME chronic fatigue, and I remember going to the doctor and saying, I've got stomach pain. He said, you've got irritable bowel syndrome. I said, I know I've got an irritable bowel, but what's wrong with me? It was kind of like the label.